I want to talk about education now because that's kind of important, I think. I spoke earlier about the nurses that all put up their hands to help in a disaster in our department, and I would argue that some of them were probably a little bit naive about what it was like to work in a disaster, like to go to a Pacific Islands and help out in a tsunami, that it's not a Pacific Island like you get in the brochures about what it's going to be like. There are dead people who have been dead on the streets for days. There are no places to sleep. You may be on a mat on the ground on rubble, and you don't really know what's underneath the rubble. There is no facilities to go to the toilet. You don't know how you're going to get your food, really. These are some of the realities that aren't pictorial like for health professionals. We see some clips of them when people go in and set up big tents and stuff, but the initial stages, it's not quite like that. So education is really important. And I think the most important thing about education is just the awareness, that people are aware about what it's like to work in a disaster. So in your undergraduate or hospital training, who receives some type of education about disasters? Yay, 1 out of us got some kind of disaster education. There was a recent survey done within the Australian universities that asked that exact question. What kind of disaster content and type do you have in your programs? 50% of the Australian universities responded, and not surprisingly, there was very little taught about disaster stuff. It may just be an hour here, an hour there, but there's definitely no robust conversation about what it's like to work in a disasters. So what does this mean for how we get educated as health professionals? It means that we rely on clinical institutions to provide the education about what it's like to work in a disaster. Who here has received some kind of in-service type education about what it's like to work in a disaster? Disaster type education. Most of you. Okay, excellent. What do we know about in-service education though? We know that commonly in-service education within your units or departments is focused around the day-to-day business of what it's like to work in the department. You'll be learning about the new drug to do with chest pain or your new chest pain protocol, your new bit of equipment to support ventilation, the person that comes in with shortness of breath, etc., etc. The stuff about disasters sometimes gets a little bit left behind because it's not the day-to-day business of our work. However, it's great to see that there's some initiatives around where disaster is at the fore and it's educating people about that. We also know with in-service education that it can be sometimes difficult to get people off the floor to actually attend in-service education. So whilst you can prepare people for, hey, we're going to do education at 2:30 this afternoon,